Hi everyone, my name is Tyler Reinmund and I'm a PhD student in computer science at the University of Oxford. On behalf of my two co-authors, I am presenting our study titled Transitioning Towards a Proactive Practice. In England, policymakers and care associations have begun advocating for the use of machine learning systems to improve the delivery of adult social care services. Adult social care refers to a range of services to support adults with essential daily activities. This care is provided by a complex system of local authorities, health, housing, and welfare services, volunteer organizations, and informal carers. According to government estimates, adult social care touches upon the lives of nearly 10 million people, as care recipients, professionals working in the sector, and informal carers. Local authorities, which are local administrative bodies with responsibilities for public services, assess people's care needs and their means to pay for care, as well as help commission care services from private providers. Despite its scale and centrality to the lives of many, adult social care has suffered from sustained underinvestment and struggled to keep up with increasing demand. In response to these challenges, policy directives and industry initiatives have forwarded machine learning as a viable intervention. Policy and research reports suggest that machine learning capabilities will reduce costs and improve service quality in the sector, yet the evidence to support such claims remains nascent. What's more, this is not the first time that novel technologies have been proposed to address structural challenges facing the sector, and we can learn a lot from this history. Towards the end of the 20th century, a series of governance and technological changes reconfigured the social care landscape. Spurred by these developments, as well as a series of high-profile implementation failures, scholars in the social work literature began to focus on how these systems affected social work practice. Much research has focused on the issues facing the design of information systems in social care, with many of the challenges resonating with human-computer interaction considerations. Despite these less favorable readings, several studies note how social care practitioners retain positive expectations for information systems. We chart these limitations as a basis for improving design initiatives in machine learning. A related area of empirical work in HCI has begun to explore the use of machine learning in social care. These studies have shown how stakeholders' experiences with welfare services affect their perceptions of the technologies that they use, how aspects such as expertise and organizational constraints shape experiences of use with machine learning systems, as well as what value professionals in public services see in the application of machine learning systems. Our study builds on this work in several ways. First, whereas much research has been situated in children's welfare services in the US, we focus on a novel empirical site, adult social care in England. This shift allows us to reveal how the economic and operational states of adult social services departments in England have tangible implications for how machine learning systems are designed and deployed, manifest through various implementation challenges. Second, recent work focuses on how practitioners use machine learning systems within their existing work practices. Few studies have focused on the work required to put machine learning systems into practice, that is, how they are implemented. We reveal the joint development of a technical system and preventive care workflow and the influence of implementation decisions on matters of interaction experience. We then use our findings to contribute to an absence of guidance for social care organizations on how to implement machine learning systems. We address the following three research questions in our study. How are machine learning systems implemented in a social care organization? What challenges arise during implementation, and how do practitioners respond to these challenges? To answer our research questions, we conducted a field study on the implementation of a machine learning system within a local authority in England, which we refer to as the project. This project was conducted by three different organizations: a county council, a consultancy, and a technology provider. Given that implementations occur over long periods of time, we found it critical to engage with participants throughout the duration of the project. From December 2022 to May 2023, I joined the group as a participant observer. During this time, I gathered data through observation of the team's work activities and meetings, 13 formal interviews, complemented by over 40 informal interviews, and analysis of documentation and artifacts that were created by the team, such as presentations, tutorials, or the outputs of anonymized data analysis. The machine learning system studied in this paper is composed of multiple bespoke and off-the-shelf software components. These components include the client management system, which acts as the repository of input data, the natural language processing component, referred to as the risk framework, which identifies risks within free text data, the machine learning model for false prediction, and the data pack, which is the user interface for the system's predictions. The workflow in which the system is used is depicted here on this slide. You can go into our paper for more detail, but at a high level, it spans 3 different stages. First, data regarding service users is recorded and input into the client management system. This data is analyzed to identify individuals at risk of falling, and those identified service users are contacted for a phone-based assessment. Through our fieldwork, we found that stakeholders conceptualized the implementation as an effort to support the County Council's transition from a reactive service to a preventive one. They framed this change as cultivating new ways of working or new practices. To do so, a complex network of stakeholders held together by a multiplicity of motivations collaborated to integrate the output of a machine learning system into a novel preventative care workflow instituted through a pilot implementation design. The project brought together a network of cross-sector groups, many of which had no experience working with one another. As a result, this project led to the establishment of relationships across traditional inter- and intra-organizational boundaries. These different groups contributed to different phases of the project, from developing the machine learning system to the delivery of preventative care services. Stakeholders provided varied responses when explaining the motivations that drove the decision to adopt the machine learning system. Broadly, each explanation falls into one of 4 types. The economic explanation characterizes the decision to focus specifically on falls as a targeted response to an identified problem afflicting the county council. Others highlighted the operational challenges facing the county as well as the welfare of its service users. And meanwhile, for the consultancy, this decision to develop a machine learning system for falls prevention emerged as part of an incipient market strategy that focuses on using these technologies to instigate organizational change within local authorities. Development of the system and the preventive care workflow were treated as 2 separate elements performed by non-overlapping groups of stakeholders. The system development followed a model-centric approach where increases in precision was the main criterion for design decisions, and these decisions were made almost entirely by technical stakeholders without input from other professionals. Meanwhile, workflow design focused on interactions between the county council and service users, such as how to initially contact those who are identified and also determining which services to offer through the program. As most of the attention was being directed towards improving the predictive performance of the system or elaborating the interactions between service user and county council, one stakeholder group was neglected: the actual user of the machine learning system. And to demonstrate that the preventive care program can achieve its objectives, the project adopted a pilot implementation design that ascribed significant importance to the role of evaluation. Evaluation strategies entail an abundance of choices. Each comes with trade-offs and subtle considerations. One of the main debates centered on the ethical issues of employing a quasi-randomized controlled trial design. The concern was commonly framed as whether the county council had the right to not provide a form of care to a service user if the technology enabled them to know that they were at risk. As these findings show, machine learning system implementations are difficult work. Complicating matters further, the project team was presented with several prominent challenges, and in face of these challenges, stakeholders responded by devising pragmatic resolutions. These were extemporaneous techniques that drew on the resources and expertise at hand to help mitigate the effect of these challenges on the implementation process. Within any one county, there are many data sources that may be relevant to a project but are distributed across organizational boundaries. For example, adult social care data may reside within the county council, while other sorts of benefit data might be controlled by other local government organizations. Several participants noted that local authorities tend to be hesitant to share data with one another, which they commonly attributed to mistrust and risk aversion. To determine which data could be used to train the machine learning model, consultants and individuals in the technology provider had to navigate tense data sharing negotiations. They attempted to minimize the amounts of data that was shared across organizations by selecting a limited number of data sources as well as data fields. This project's span across traditional organizational boundaries posed not only difficulties for navigating data sharing agreements, but also for negotiating how the preventive care program would be delivered. Many of the services the team hoped to refer individuals towards are grappling with capacity constraints of their own. Therefore, the team had to reassure the services that they would not be overburdened by this newly uncovered demand. As a first attempt to provide this reassurance, individuals on the team tried to use local feature importance calculations to infer which intervention a service user would likely receive. Unfortunately, this failed because the features used in the model did not align with the interventions included in the program. So in response to this obstacle, the project team divided the population of service users into batches, each of whom were contacted in intervals. The technology provider considered the risk framework, which was the natural language processing component, to be its intellectual property. Therefore, understandings of it among the consultants, county council, and the research team were quite limited. This obfuscation led several consultants to refer to the risk framework as a black box and impacted their ability to conduct rigorous evaluations. And as a result of this limitation, members of the consultancy devised workaround evaluation methods, which they referred to as dip checks, and we describe these in detail in the paper. A salient concern among the project team was whether the population identified by the system was appropriate for the preventive care program. Throughout the project, different notions of what constitutes the right cohort emerged. At its current design, the system can only generate predictions on those who are already known to the county's Adult Social Services Department due to the outcome of the data sharing negotiations discussed earlier. This feature was considered problematic by some practitioners who thought that the goal of the project was to engage with people not known to the social care department. This concern was commonly allayed by the consultants and technology provider through references to the future direction of the project. Data sources beyond adult social care will be consumed by the machine learning system, so it can generate predictions on those who have not engaged with the services department. During our fieldwork, it became apparent that several HCI considerations were not acknowledged. So we explored how findings from our research area would affect design. Towards that, we created an alternative workflow, which we then validated with stakeholders. The principles and guidelines we derived were based on several of the studies discussed earlier in this presentation. We redefined the workflow so that predicted risk scores were integrated into existing information systems rather than requiring a novel interface. You can read the paper to learn how stakeholders from the 3 different organizations considered this alternative workflow. We'll conclude with a brief discussion on areas for future research. Most studies in HCI tend to gravitate towards 2 ends of the machine learning lifecycle, design and use. Conspicuously absent from empirical concern is the messy in-between, the work of implementation. Through our fieldwork, we highlight the importance of attending to implementation as an empirical site in HCI. And in this study, we revealed the strenuous efforts required to put machine learning systems into practice. Some of this labor took the form of pragmatic resolutions devised by project stakeholders. With a growing concern in HCI to move beyond a preoccupation with users and account for the needs of a diversity of stakeholders, future research should explore how HCI can support these critical roles in their efforts to bring machine learning systems into practice and compensate for the inevitable breakdowns that arise as technical systems are put to work in the flexible and nuanced world of organizational life. And since various scholars have argued that interventions to design practices are most effective when they're based on practitioners' existing techniques, we propose that future research should identify how practitioners in a range of organizations attempt to address implementation challenges as a means to inform design interventions. In this study, we describe the experience of implementing machine learning systems in social care organizations. We reveal the complicated network of stakeholders implicated in catalyzing the County Council's efforts to transition towards a proactive practice and the diverse range of social, technical, and legal challenges presenting to such projects. We discover the importance of pragmatic resolutions and contending with challenges as they arise during the practical, day-to-day work of system implementations. We'd like to thank the teams at the County Council Consultancy and Technology Provider for engaging with us in our research. Thank you very much for your attention, and please read our paper to learn more.